Good morning and welcome to United Way for Southeastern Michigan's virtual town hall. My name is Dr. Dershawn Brown, and today we will be continuing our equity town hall series with the discussion on equity in Black maternal health. Our guest speakers will answer your questions the last 10 minutes of today's town hall, so please leave your questions in the Q&A box if you're watching on Zoom or in the comment box on Facebook. Now, I would like to welcome United Way's President and CEO, Dr. Darian Hudson, to say a few words.
Thank you so much, Dr. Brown, and good morning, everyone. Thank you for joining us again for another town hall. This is our second town hall that is focused specifically on equity with a topic that is near and dear to me and to many of us here in the city of Detroit. There were many health inequities that existed in our community long before the pandemic started. The one that we are focusing on particularly today is Black maternal health. We are so grateful to be joined by two experts, and I will say equity warriors in this area, Nkenge Browner and Shanayl Reed. And Nkenge is the organizing director for Mothering Justice, where she coordinates community conversations with mothers of color to understand what their needs are within the community, and she uses this information to determine what asks to make of legislators. And Nkenge has also served as a fundraising chair for Black Lives Matter Detroit, co-organizes a national community baby shower specifically serving Black mothers, and was previously employed as a specialist for intimate partner violence, advocating for trafficking survivors who experienced homelessness in Detroit. Thank you, Nkenge. Shanayl Reed is a certified community health worker at Henry Ford Hospital. She has provided support and care to the women in her community as a birth and postpartum doula for the past 4 years. Shanayl is currently working on the research program We Care, which provides women with family planning, social needs, and preventative reproductive health services. And thank you, Shanayl. We are so happy to have both of you here with us today. And without further ado, I'm going to turn it over to both of you to begin this critical presentation. And so welcome, and the floor is yours.
First, you unmute. Okay. Salam, everyone. I'm going to talk a little bit about mothering justice, the work we do, and how it relates to our equity topic today. And then Shanayl, one of our favorite mamas at MJ, who does work in the community, will then go in depth a little bit more about her experience with this topic, being someone who works directly with mothers and in a hospital setting. So Mothering Justice does policy work for mamas of color. Our current campaigns are affordable childcare, and our goal there is to secure federal funding for informal and formal caregivers. We know one of the ways that we bring equity into childcare is to pay the folks in our lives who are also providing childcare. Before COVID and now, even more, we see that everyone doesn't have access to formal facilities. Some people want grandma or auntie or cousin to watch those babies, and that's always been a thing within people of color communities. But often that work is described as women's work, and there's undervalued and not paid and not given the money necessary. So our campaign goes to secure formal and informal funding there. Our other campaign is paid family leave, and we've led the effort in Michigan to make sure that COVID and pandemic care is covered. During this time, we really learned, like, a lot of our service workers were also parents, also mothers, and we know these issues are interconnected. Then the campaign that I take lead on is our Black Maternal Health campaign. Our goal there is simply to lower these numbers that we're seeing. So Black mamas are twice as likely to experience loss, either infant or maternal loss themselves. And we went over the studies, and we wanted to figure out, why are we experiencing loss at this rate, right? And so lots of people that do research, lots of doctors, lots of folks put a lot of time, money, and effort into figuring out, why are Black women dying in childbirth, and why are their babies not making it to their first birthdays? Is it their diets? Is it their hair chemicals? What are Black mamas doing that are causing these numbers? And what all of that research all of that time led to and let us know is that medical professionals have personal biases that cause them to not listen to Black women in labor. And it really came down to not hearing Black women say my pain level is at a 10. And they think, well, their personal bias caused them to think, well, you're a Black woman, or you're a plus size Black woman, or you're a dark skinned Black woman, or whatever the bias is. And therefore, I'm going to put your pain is actually a 6. You're okay. I'm going to send you home. Black mamas then go home, often experience hemorrhaging, other issues, and die from childbirth because they were not responded to in a manner that they should have been. So we sadly figured that the way to lower these numbers is to be able to make sure that folks are dealing with and answering to and being honest with themselves first about personal biases so they could simply listen to us, right? So Mother and Justice has a radical reproductive justice table. And a lot of times the reproductive justice conversation stops at abortion access or health, being able to access things people call like women's clinic, right? And these things are absolutely necessary and part of the fight. But reproductive health goes way past that, right? We also want to welcome elders into the conversation, want to welcome folks who may not identify as mama or as woman. We want to make sure that folks who have no desire or may not have the ability to reproduce or to have a child are still welcomed into this conversation, because these issues do not, they don't stand by themselves. Reproductive justice is connected to affordable childcare. For affordable childcare is connected to paid family medical leave, paid family leave. And all of these things are interconnected, and we can't, if we take down just one part of the issues, then we leave the foundation for everything else to stand. So during our reproductive justice tables, we had a group of moms during last month. We celebrated and acknowledged Infant Loss Week. And during that time, the moms of color and the reproductive justice table and the moms who identified as white were able to identify that even in a situation where someone has experienced infant loss, that Black moms were still not giving the equity within the hospital and the response that other moms were receiving. One of the things that kept coming up is during an experience of loss, moms are often given the opportunity to still be in touch with a photographer for the baby, and giving what's called, I forget the technical term, but it's an ice bed to keep the baby in a room with mom as long as possible. There were Black moms on the call and on our table who did not know that that was available. It just simply wasn't offered to them. So when we think about equity, it's not just, it is access, but it's not just access, right? It's also in situations like this where you are still want to make sure that you see this person as a whole human, and this is not just a medical experience. This is an experience that will impact the rest of their life. And so we want to move into identifying those biases so that we can also offer the support necessary to Black moms when they are patients and concerning their maternal health, and not limit their care based on our own biases. So our campaign work around Black maternal health is to definitely lower those numbers. And we know that we can do so by first addressing biases within healthcare professionals. And that is why a lot of us are, I know recently many of us have seen, I don't want to call it a switch, but we've been talking more about doulas and home births and making sure we have access to those things, right? And that's such a productive tool when we talk about equity with Black maternal health. So when COVID first started and we didn't know what was what, Mother and Justice hosts the Black birth workers brunch. And I got in touch with the Black birth workers and I just said, can we just come up with a list of you all who are still willing to go into homes during COVID? We had mamas calling us like, I don't know what to do. I don't know if I can go to the hospital. None of us knew what to do in the beginning. And a lot of moms wanted to switch over to home births. And we had birth workers, beautiful birth workers, who decided to lower their costs, allow payment plans. right? These are the equity steps that we have to take within our community. We have to answer to the right now. So they develop payment plans. Someone told me that they paid their payment plan off on their baby the week of their baby's second birthday, because the birth workers, Black birth workers, while they're not being supported, are making sure that they still offer support to mamas in need, and making sure that we're making home birth an accessible tool, an accessible thing that we can access, so that there is some equity. We're not going to change the hospitals overnight. We are going to continue this campaign to affect and change the hospitals. In the meantime, our babies are still coming. So what do we do? And this is why we support birth workers as one of our tools for a more equitable space for Black mamas. Speaking of birth workers, I'm going to introduce Shanayl, who's going to tell us a little bit more about this subject and what she does as a doula.
Hello, hey everybody. I'm so honored to be here with my sister Nkenge and these two lovely women, Dr. Hudson, Dr. Brown. Thank you guys so much. I have been a doula, birth and postpartum, the past 4 years, and I have, in the last 4 years, have seen a great and positive surge with the support of Black birth workers in the community, and I'm happy to see that it has continued, and I believe will continue to be something that is at the forefront of conversations when women in our community discover, or families, excuse me, in our community discover that they are with child. It is a great work to do. It is a sacrificial work to do. I believe that all the work that we all here do on this panel is sacrificial. So once again, I say thank you. I'm just gonna, I don't want to say breeze through, but I'm gonna tread lightly with some information. So for those that don't know, infant mortality is the death of a young child under 1. And maternal mortality rate, excuse me, it refers to the death due to complications from a pregnancy or childbirth, which can happen up to 1 year after a child is born. So what we've realized so far, just to follow up with what Nkenge said, is we've talked to women in our community, and what they are saying is that they don't feel heard and they don't feel listened to. So they will say their doctor hasn't listened to them. They will say things like, the doctor made me. So there's a sense of coercion there of some sort to a certain extent. They would say, well, I didn't know I had options. So they're not clear about what they can do or what's open for them to do. They'll say things like, I've complained several times before I even went in labor about this issue or that issue. Once again, not feeling heard. And they will also say that they were told that they had to do something. So from that, we've discovered this is why Black women and babies are dying. So Michigan is ranked 40th for now. That is unfortunately a rising number. And for every 1 in 6 Black babies is dying compared to 1 in 10 babies overall. So that is an alarming number. And over the years, we know that plenty of physicians, doctors, and researchers have been trying to figure out why, as Nkenge said. But us in the community, we know why. Is more so just not being heard, not being listened to. Unfortunately, biases that are taught over a length of time. And I do believe that some are willing to unlearn and are unlearning because we all naturally have biases. But to be aware and to tap into what it takes to unlearn those biases is what's going to help us make progress in the end. So African American women are at 26.5% for deaths. Non-Hispanic women are at 10%, and all other women are at 12.7%. To me, all the numbers are high, but with ours being over double the others, says a lot. So the whys are different. Most recently, we know that, and most commonly, we hear preeclampsia, which is just a form of high blood pressure while you're pregnant. But why? That could be anything: food shortage, transportation, stress levels, trauma, several different reasons why our blood pressure is high during these times. Some people just don't like the doctor because of history and because of trust issues. So a mama may be just fine. And as soon as she gets to her doctor's appointment and they take her blood pressure, it's high. You know, maybe it's high because she really doesn't want to be there. Maybe it's high because she doesn't know what's going to happen, or she's already got gathered in her mind that the doctor is going to say something negative or something that she doesn't hear, or that she's going to experience some type of resistance when she talks with her physician about her birthing desires. So our history with reproductive justice has not been great, all the way from slavery up until now. We have dealt with trauma. We've dealt with non-consensual agreements. We've dealt with coercion. Um, Back in the day, we had two sisters who were special needs, and they were coerced by a doctor to sign paperwork saying that they could be sterilized. And once the mother, yes, ma'am, yes, ma'am. And once the mother found out, she was able to save her third daughter from the paperwork. What the doctor stated is that those women who were in those situations, meaning Black, poor, uneducated, did not need to reproduce. So these are the kind of things that we've dealt with. We've dealt with mothers getting coerced, doctors, physicians coming into projects, coercing women with gift cards and things of this nature. That's just to give some history. So from that to now, yes, we have more of an open space, and yes, we have more time, an opportunity to speak our minds. But even then, still, some of us still feel unheard. And it's not a money thing. It's not an issue of class. It's just an issue of Black, unfortunately. We've heard all kind of stories. Several Black mothers, up until this recent, the doctor that passed away, these women are educated. They know well. They're in the know. They have insurance. They live good lives, quote unquote. So why are they still dying as well? We've heard Serena Williams and even Beyonce speak about their experiences of being rushed to the hospital, almost dying, losing blood, too much blood, not being heard by the doctors. So what we can do to help is first realize that is, like I said, it's not a class thing. Second, it's just a thing of being heard and being able to speak out. We have several organizations across Detroit that are helping Mothering Justice, WIN Network at Henry Ford Hospital, the Michigan Institute of Health and Population, Sister Friends, Black Mothers Breastfeeding Association. These are all organizations that you guys have access to, that we all have access to, for information and for support. So hopefully that was helpful to everyone that's listening and that will listen. All we can do at this point is just support each other, listen to each other, and then help each other translate that into going in with physician. Family support, any kind of support is everything. So thank you guys so much.
Absolutely. Thank you all both for that startling statistics. I mean, I'm over here just trying not to make too many faces of like, wow, this is wow. And I just thank you both for doing what you do to help to decrease those numbers and helping baby mamas, as you call them. Thank you. So now we're going to go ahead and jump into our Q&A session. We have a few questions that came in, and one is to Shanayl. At times, I believe my doctor is treating me differently because of my race. I want to be heard, and I don't want my concerns swept aside. What should I do if I believe my doctor is not listening?
What I will tell her the same thing I tell my families. Speak up, be direct, and be honest. Tell your physician just like that. I feel like you're not listening to me because I'm black. Say it just like that. Don't be afraid to say those words. You know what I'm saying? Don't be afraid to say, because I am black, I feel unheard by you and the staff or whoever it is. And also remember that you have options. You can switch physicians. You are not bound or obligated to stay anywhere where you do not feel comfortable and you do not feel supported.
Absolutely. Thank you for
If
that.
I can add one thing to that, it's also important that you document. All patients have access to their own medical records at any time. You can review those medical records to make sure that it includes the information that was discussed during your meeting. And if it's not included, you have the right to send them a note, whether it's through my chart, you can email them, you can mail a letter to say that we had this conversation, this is what I shared with you, and this is what I expect to see in my records. And I think we have to do a lot more education around what we have within our rights. So I thank you, Shanayl. I just had to add the putting it in writing is also very, very important.
Thank you for that, Dr. Hudson. Great point. Another question. I have a question. What can I, as a mother with privilege, a white ally, do to help support equity in Black maternal health? And this is for either Shanayl or Nkenge.
So again, I do policy work with Mother and Justice, and I believe in that. How I believe in that situation. One, we have a fellowship for white women who identify as allies or who want to be identified as allies, because you can't really identify yourself. At Mother and Justice, specifically around this subject. So if you want to know more about that fellowship, please get in touch with motherandjustice.org. However, I think that sometimes, like the person that posed the question before saying that they're afraid to speak up, sometimes you can identify the problem, right? If you are a safe person that folks can come to, then you can turn around and go. You can go with people and be support, but you can also address doctors head on. And sometimes it's a little bit easier. I'll address my own biases. It is much easier for me to accept from a Black woman that I might be wrong about something than perhaps a white man, right? I'm gonna enter that conversation a little bit differently. So if you are involved in groups, if you are involved in birthing groups and things like that, and folks feel like they can't advocate for themselves and they give you permission or ask you, because you don't just wake up and decide to be advocate for somebody else, but if folks give you permission or ask you to go, there's a hashtag on Twitter that I love, and it's Get Your Cousins. And it's about white folks addressing white folks in their own biases within their community before then making Black women do the labor of addressing that bias. So being involved in groups that are racially specific, and then once you're in those groups, folks feeling safe enough for you to ask you to advocate in those spaces.
Okay, great. Thank you for that. Another question. This is for Nkenge. Mothering Justice has a mama's agenda for specific advocacy goals and campaigns. How has the agenda been impacted by COVID-19?
So our paid family leave, that kind of, I don't want to say a switch focus, but it definitely added the focus of pandemic care. Or pandemic protection. Before COVID, we did not know that we needed global pandemic protection, right? And also didn't realize that many of the workers who, on both sides, on the layoff side, were often, so in Michigan, Black women, I want to say are 70-something% of us are head of household. Whether we're married, single, or whatever, Black women are the breadwinners, in Detroit specifically, right? And so those who experienced layoffs that affected Black families and Black children, and those who were essential workers were also the highest rates of moms in general. They happen to be mothers, people who are mothering in the household. And so it shifted our focus there from, yes, we need coverage for chronic care or chronic issues and things like that. But there are also these things that are beyond anyone's control that we have no protection for. And so I think COVID allowed us to see what the flaws already were, but it pressed up against them so hard that we could no longer ignore them and had to shift our policy work around the gaps, even our affordable childcare. Now that childcare places are closing, we need to turn this focus onto informal care, which the Black community, Black mamas already knew that. We've been dropping our babies off at Auntie's house, right? But now we needed this to be a system that was in place so that Auntie was also getting paid for this.
Wow. We have time for one more question, and it's around mental health. So maternal mental health isn't always talked about, and COVID-19 is creating additional mental health challenges. How does mental health relate to your work, and what do you wish mothers knew?
Ooh, okay. So that's a good question. I've actually been digging into this for the past month or so. And I've gotten in touch with a couple of mental health counselors who deal specifically with maternal health and maternal issues. So I would just let most of the mothers know that you are not alone. And surprisingly, uh, from what I understand, we all have some kind of mental health concern. So you're not alone. We all have things that we experience and we should talk about or have the opportunity to discuss with the professional who can help us sort out those feelings. There are some women, it is limited. And me and Nkenge have, and some other beautiful women have been working on just gathering resources around that subject for women to have access to. But that is something that has been coming up, especially because of COVID. And a lot of people are, secluded or alone or by themselves. And sometimes even if you have support, it's still an overwhelming experience to become a parent. So we're working on resources for that. They are available, so they can reach out to me and Nkenge if they want to get in touch with someone. But that is definitely something that's on the floor.
Okay, great. And we'll make sure to share your contact information for those that are interested in the chat box. And I love that you are not alone. And that's so important right now. So again, thank you both. And unfortunately, that's all the time we have for questions. So I'm going to go ahead and turn it back over to Dr. Hudson.
Thank you, Dershawn, and thank you so much, Shanayl and Nkenge, for being with us today and for the information that you shared. I'm sure we'll have more questions. This is on Facebook Live. It is going to be on our website. And so as we continue to get questions, we'll make sure that we share them with you. And again, just thank you for your advocacy. We all have a role to play. My sister is a neonatologist, and she's telling me every day, anytime I have friends who are pregnant, they know you got to call Kara, and she walks with them through the whole process, even though she's not an OB, but she makes sure that they know all the questions to ask and things like that. So your advocacy matters. And I just want you to know that you aren't alone in this fight either, because there are people around the country who are trying to get their arms around this. And so thank you for leading the way and for setting that example for us. I think it's a good way to lead into Thanksgiving, don't you? I really do. So thank you for joining us. We did want to remind you, we were talking about Black maternal health today, but we are here to help 24/7. We still have our helpline 211 that you can call anytime. You can also go to unitedwaysem.org/211. If you are listening to this and you're trying to figure out how to pay a utility bill, your light or your gas or your electric, if you are trying to figure out how to have food tomorrow for Thanksgiving, please call 211. There are a number of places today that are passing out food, that have boxes ready for you, so that you do not have to have an empty table on Thanksgiving Day. So we encourage you, please, to call 211 with any need that you are experiencing, but especially at this time of year. This is where you want to go if you have food or housing needs or any healthcare needs that you or your family are facing. So next week, when we come back together, two things. I'm sorry, before we go there, it's still not too late to advocate for the COVID relief bill. We still need your help. We need you to call Congress to help us pass a COVID-19 relief bill now. We know that we have a number of Michiganders who are out of work, who may continue to be out of work through the winter. We have a number of households that still don't have what the resources they need to put food on the table, and childcare continues to be a struggle, and our centers being able to remain open during this time. So we urge all of you who are listening, please go to standwithunitedway.org to take action now. Call your congressperson and urge them to pass a COVID-19 relief bill. And last but not least, next week when we come back, we are going to be hearing from Dr. Natasha Bagdasarian. She is from the Michigan Department of Health and Human Services, and she's the senior public health physician who is going to be sharing some very important updates on how we can stay safe during this pandemic, during the holidays. And so that will be Wednesday, December 2nd at 10 a.m. If you would like to see other town halls that we've held in the past, please go to unitedwayscm.org/virtual town halls for more information. And with that, just know how grateful we are for all of you who continue to follow us on these town halls. For those of you who are listening, a little discouraged, you're not alone. There was one important takeaway that we heard today, and is that you are not alone. So blessings to all of you. Stay safe, stay healthy, and stand united.